Is oral sex safe? In this video, you'll find out and we'll explore the latest research, discuss potential risks, and share tips for practicing safe oral sex. So, let's get to the video right away. So, oral sex involves using the mouth, lips, and tongue to stimulate a partner's genitals. It includes various activities such as oral stimulation of the penis, of the vulva and clitoris, of the anus, also known as rimming. Oral sex can be a pleasurable part of sexual activity and is practiced by people of all sexual orientations. It is quite common in adults. According to a survey, more than 80% of the adults 20 to 40 years old reported engaging in oral sex. So the real question is it safe? Well, oral sex, like any sexual activity, carries some risks, but with the right information and precautions, these can be minimized. The risks involve some common sexually transmitted infections like human papillomavirus, one of the most common STIs. HPV can be transmitted through oral sex and has been linked to oropharyngeal cancers. Vaccination is a key preventive measure. Another one is herpes simplex virus. HSV1, commonly causing cold sores, can be transmitted to the genital area through oral sex, and vice versa for HSV2. Some bacterial infections like gonorrhea and chlamydia that can affect the throat, causing symptoms like sore throat and swollen lymph nodes. Also, HIV. While the risk of HIV transmission through oral sex is lower compared to vaginal or anal sex, but it is not zero, especially if there are cuts or sores in the mouth. Moreover, syphilis and hepatitis A and B can also be transmitted through oral-anal contact. Now, let me share some of my research findings. Recent studies highlight the increasing incidence of HPV-related oropharyngeal cancers, particularly among men. The CDC recommends HPV vaccination for both boys and girls to reduce this risk. Poor oral hygiene can increase susceptibility to infections during oral sex. Regular dental checkups and good oral hygiene practices are essential. One thing that I found in almost every paper was use of condoms. Please note that STIs can also affect more than one region of the body at the same time. Several STIs are symptomless. So, if you have one, you may not realize it, even if you don't have any symptoms or indications. STIs still can be spread. If a person is exposed to an infected partner during oral sex, certain things may raise his or her, acquiring HIV and other infections like poor oral health, which can include tooth decay, bleeding gums, and oral cancer as well. During oral sex, you can lower your risk of contracting STIs for oral sex performed on the penis. It may be a good idea to cover the penis with a non-lubricated latex condom. For oral sex performed on the vagina or anus, use a dental dam. You can also cut open a condom to make a square and put it between your mouth and your partner's genitals. So, what are the safe practices for oral sex? Well, number 1, use protection. Second, regular dental checkups and good oral hygiene reduce the risk of infections. And most important, get vaccinated. HPV vaccination is highly effective in preventing HPV-related cancers and infections. Also, hepatitis A and B vaccinations are also recommended. Now, this video doesn't mean you cannot enjoy or you should not have sex. Being in a long-term relationship with someone who does not have STI, for example, a person who tests negative for STI, please keep this in your mind that many individuals with an infection may be unaware of it. STI are frequently undiagnosed and untreated. If you have more than one sexual partner, then the chance of getting an STI is much higher. So, ask your doctor to test you for sexually transmitted disease and HIV every time you have sex with a new partner, or more often depending on your situation. It's always recommended to discuss STI status and sexual history with your partner. So, stay informed, Communicate with your partner and practice safe sex to enjoy a fulfilling sexual life. Thanks for watching.